So I'm going to demonstrate the knee exam today. I have my patient Terry here who is going to work with us. For my knee exam, I like to go from a standing to seated to supine position in order to minimize the amount that the patient has to move back and forth. I will be demonstrating my full knee exam today, but in your specific case, you can either do a focus exam or sometimes if your patient's not as mobile, you can eliminate certain parts. All right, Terry, so we're going to start with you standing up. So stand up for me. And then standing with your feet a comfortable distance apart. I'm going to have you pull up the gown just a little bit so we can actually take a look at the knees here. We're just going to start with some inspection. You're going to be looking for any asymmetries, looking at the patella, making sure that neither side is too elevated compared to the other. And you're also going to look for valgus or varus deformations. Basically looking on and comparing the aces bone line to the patella in that angle versus the patella to the tibial plateau. And whether it's curving outwards or inwards. The other thing I'd like to do is take a look at someone's gait, make sure they're not antalgic or limping along, and also taking a look at their arches and making sure they're not either too flat-footed when they take a step or their arch remains too high when they take a step. So Terry, let me have you walk back and forth for me. Looking at his gait and looking at the arches of his feet. Great. Alrighty. And then this next part I like to have patients do is called the Thessaly maneuver, and it's to test for meniscal injury. You can also do the McMurray's, which I'll demonstrate later, but this one I prefer because it's a little bit easier on the provider. So Terry, let me have you actually plant your hands up against this table here. I'll get out of the way so we can actually videotape this. Now I'm going to have you on one foot. Perfect. Bend to about 20 degrees. Great. A little bit less than that. And now rotate on that knee 3 times back and forth.
Like this?
Keeping your feet planted.
Oh.
Great.
Oh.
Yeah, and so you're looking for any popping, catching sensation, or pain with that maneuver.
Okay.
And go ahead and do it with the other side.
Rotating outwards.
Back and forth around the knee joint.
In and out.
Great. Perfect. And I hear a little catching popping there.
That's my ankle.
Okay, that's your ankle. Great. Go ahead and have a seat now. We'll move to the seated portion of the exam. Okay. Right. So the first thing then I'm going to take an inspection. And we're going to feel, sorry, my hand's a little bit cold, but feel for any warmth, feel for any erythema. And we're going to do a good palpation. I'm going to raise you up a little bit so I don't hurt myself doing this. Great. All right, so I'm going to feel along the quadriceps tendon over the kneecap, the patella, and you let me know if I'm causing you any pain or discomfort. Going down to the patellar tendon, the tibial tubercle, and the pes anserinus. And then you want to feel along both joint lines. You can usually get a good feel of the joint lines by providing some inferior traction and finding the cusp right there. And feeling along the medial joint line, up to the MCL, and the lateral joint line, to the LCL. And you can have pain there either with intra-articular pathology or meniscal pathology. You would do the same thing with the other side as well. Now let's test range of motion. Let me have you scoot forward just a little bit more so you can get to 135 degrees of flexion. Now let me have you tuck your heel back all the way to the table there and all the way out. Great. All right, so good active range of motion, and then usually you have your patient do one side at a time. And then passive range of motion again. Great. And feeling for any crepitus on this side as well. Great. Now we can do some strength testing, so I'm going to have you kick out against me. Good strength, and pull back in. Great. And repeat on the other side for strength. Great. Now, for my ACL PCL test, I like to do this version of anterior and posterior drawers. So I'm going to raise you up just a little bit more. And then facing the patient, I'm going to let them know that I'm going to trap the lower leg between my knees. Brace yourself so I don't pull you off the table. All right, you're going to pull out, looking for that firm end stop, and push in. Again, looking for a firm end stop. Great, and repeat on the other side. Perfect. So now we're going to move to the supine portion of the exam. So let me lower the table back down. lie back for me.
Really high.
And go ahead and keep your legs straight. Go and straighten your legs. Thank you. And if you want to come a little bit closer. Great. All right. So the first thing I'm going to do is look for a knee infusion. So you're going to try to, if there's any fluid in there, you're going to try to get it all up superiorly. And then what you're looking for is this bulge in the medial side here as you compress down. And if he had fluid, you would see that dimple fill back out as you push the fluid back down. That's the bulge sign. Alrighty. And then we're going to test for LCL and MCL stability and strain. So for this one, I like to have the heel just off the edge of the table here. Knee should be slightly flexed so that you get the kneecaps out of the way. Now you're going to valgus stress and varus stress, looking for pain or instability. Great. And then if I had done the Thessalys test already, I wouldn't do the McMurray's here, but just to demonstrate for completeness sake, we're going to do the McMurray. So I'm going to take your knee, and then why don't you come to an angle so we don't expose him too much. So why don't you come here? Great, thanks. All right, so I'm going to bend his knee all the way in. With my offhand, I'm going to be feeling the joint line.
Okay.
And then we're going to bring him out to external rotation and the extension. Again, looking for any pain, catching, or popping. Back to midline. We're going to go to internal rotation and out and back in. Great. And again, do the same thing on the other side. And that is essentially my knee exam. Hopefully with that, it will help you identify which parts of the knee are bothering him and help narrow down your differential so you know how to proceed for your patient complaining with or presenting with knee pain. Thanks.